Hello class, and welcome to my presentation on sugar-sweetened beverage consumption and its association with BMI. Using data analysis from the Behavioral Risk Factor Surveillance System 2016 for the state of New York, over the next few slides I will be going over background information, methods, results, conclusion, and a proposed research intervention. Obesity is a complex public health problem with a number of contributing factors. However, one of the main significant factors associated with weight gain is increased energy intake from the consumption of sugar-sweetened beverages such as fruit juices and soda. The past 30 years has been marked by increased consumption of SSB among both adults and children. Since the 1970s, energy intake from SSB increased by 2.8% to more than 7% by the year 2001. Energy consumption from SSB became increasingly popular as it became more convenient. The emergence of vending machines, restaurants, fast food establishments, and corner grocery stores within New York neighborhoods played a big role in increased SSB consumption, which is one of the main factors contributing to the overall high prevalence rate of obesity in New York. According to the State of New York Behavioral Risk Surveillance System, between 2000 and 2010, the prevalence of obesity increased by almost 40%. From 17.7% in the late 2000s to 24.5% by 2010. It is estimated that 6 out of every 10 adults in New York suffer from overweight or obesity. To date, the obesity rate among New York adults is higher than Healthy People 2010 original objective of 15%. Obesity shows its highest prevalence in adults between the ages of 45 and 64 at 30.5% and its least prevalence among those between the ages of 18 and 24 at 11%. Additionally, 1 in every 5 children in kindergarten and 1 in every 4 children in Head Start are considered obese, resulting in more than half of all elementary and Head Start children within the state of New York as being obese. The specific aim of this study is to examine the relationship between SSB consumption and BMI. The Behavioral Risk Surveillance System is a data collection tool utilized to collect information regarding health risk behaviors, chronic health conditions, and preventive measures being taken. Telephone surveys are conducted by way of random digital dialing, which is a method used to randomly select individuals to partake in statistical telephone surveys. Data collection process is completed with assistance from the Centers for Disease Control and Prevention, call centers, and universities. The linear association between sugar-sweetened beverage consumption, BMI, was examined for the restricted subset of data for 34,190 New York residents. In addition, variables sex, age, race, education, history of CVD, and ever diagnosed with diabetes was included in the analysis. The variables of interest was categorized as continuous, binary, or categorical, and were either collapsed to create new variables, recoded, or broken down into levels. To examine the outliers and errors, variables were examined separately. Using the indicator variable include and generate, variables of interest were excluded, created, or replaced. After recoding the variables of interest, all covariant variables were adjusted for. Data restrictions, recoding, and analysis was completed using Stata IC in the Behavioral Risk Surveillance Codebook. The overall results of Table 1 suggest that the frequency of SSB consumption is a main factor with BMI status. Looking at the outcome of obesity, the number of sugar-sweetened beverages consumed per week were equally high across all categories. Of those sampled, white people suffered higher rates of obesity and overweight, and when comparing those with some college or college graduates, individuals with high school education or less suffered higher rates of obesity. Participants who made more money suffered higher rates of obesity than those who made less money. And for history of CVD and ever diagnosed with diabetes, participants within the normal BMI category was lower than the overweight and obese categories. Table 2 consists of the outcome results of the adjusted and unadjusted linear regression. The results suggest that sugar-sweetened beverage consumption of more than 7 per week is significantly correlated with BMI, with a p-value of 0.25. for unadjusted and 0.02 for the adjusted model. For sugar-sweetened beverage, consumption of 0 or less than 1 was also significantly associated with sugar-sweetened beverage consumption and BMI. Participants categorized as having some calories were significantly associated with obesity with a p-value of 0.001. And notably, history of CVD was not significantly associated with sugar-sweetened beverage consumption with a p-value of 0.37. However, ever diagnosed with diabetes was significantly correlated with sugar-sweetened beverage consumption with a p-value of 0.000. The main objective of this study was to examine the relationship between sugar-sweetened beverage consumption and BMI. The overall findings suggest that weekly SSB consumption for New York residents is significantly associated with overweight and obesity. Although potential confounding variables varied in significance, variables such as race, education status, physical activity, and diabetes had a major influence on the outcome result or overweight and obesity percentage. The main takeaway from this finding suggests that sugar consumed from drinking soda and fruit juices is a major health risk. Therefore, future research should focus on alternatives to substitute for sugar-sweetened beverages and decrease its intake. In proposing an intervention in an attempt to reduce the consumption of sugar-sweetened beverages, a sustainable approach towards effective preventive strategies is necessary. I am proposing a combination of strategies that include previous used effective research intervention, governmental policies, state-level programs, shifts in the environment, and educational-based programs. Thus, previous research, Friedman et al. Effectively demonstrated that a sugar-sweetened beverage price increase of 35% or more resulted in a 26% decrease in sales. And when coupled with a community-based education program, there was an additional 18% decrease in sales. Many public health experts and policymakers both agree that taxing sugar-sweetened beverages is probably the best strategy to improve on the nation's obesity epidemic. Thus, as many as 24 states across the U.S. and 6 cities have proposed or implemented an increase in sugar-sweetened beverage tax. As a result, several states have witnessed at least a 24% reduction in the consumption of sugar-sweetened beverages. In addition, states that have exercised the penny on ounce tax that increase sugar-sweetened beverages prices by 10% or more have seen an 8 to 12.6% decrease in consumption. To address environmental factors with SSB consumption and BMI, it is necessary to address the interactions between individuals and the environmental factors. Environmental approaches that support healthy diets is the key strategy to reach public health goals of reducing obesity. Strategies to improve the beverage environment can include increased access to stores and markets that provide affordable health beverages, decreased access to vending machines in schools, workplaces, and government buildings, and lastly, offer competitive food environments that promote healthier eating and drinking alternatives to fast food and sugary drinks. In my opinion, education continues to be one of the best practices. Statewide education programs should be implemented to raise community awareness about the health outcomes associated with sugar-sweetened beverage consumption. In addition, by way of posters, social media, television commercials, medical professionals, and school systems, an increase in advertisement of alternative healthy drinks such as water with infused fresh fruit, natural green tea, fresh fruit or vegetable smoothie, and sparkling seltzer water is imperative to attempt to reduce SSB consumption. Therefore, I am a firm believer that with effective policies that support taxation of sugar-sweetened beverages, addressing environmental factors, and a promotion of healthier consumption of liquids, we will see a significant decline in obesity resulting from sugar-sweetened beverage consumption. For those studies that show a weak or no associations between a consumption of sugar-sweetened beverages and obesity. They are pretty much funded by the beverage or sugar industry. This concludes my presentation on SSB consumption in its association with BMI. Thank you for your attention and a wonderful semester.